Canada's healthcare system is greatly strained. With a large, aging population that is living longer with chronic illnesses and a rising demand for end-of-life services, costs are escalating and the way we use our resources is becoming unsustainable. Currently, hospitals are still the main providers of end-of-life care for over 70% of Canadians, with about 15% ending up in intensive care units on their final hospital admission. More importantly is the fact that most elderly patients do not want their final days to be spent in the ICU. Peaceful deaths with comfort measures is what they desire over life-prolonging, often futile treatments. Since our strive is to always deliver quality, patient, and family-centered care, we as healthcare professionals must make advanced care planning a priority in our practice. With that being said, the PICO question developed for this topic was, in elderly patients with high mortality rates, does advanced care planning reduce undesired ICU admissions? My review and critique of the literature found advanced care planning has several benefits for chronically ill, elderly individuals, their families, and the healthcare system by alleviating both emotional and financial constraints. Evidence supported reduced hospitalizations and ICU admissions, decreased deaths in hospitals and ICUs, significant annual economic cost savings. Although the literature supports advanced care planning does in fact reduce unwanted ICU admissions or hospitalizations in general, I also found a large number of barriers, including huge communication and documentation gaps between patients, families, and healthcare professionals, a lack of comfort, skills, and resources for healthcare professionals to facilitate advanced care planning discussions, and conversations around death and dying are uncomfortable, taboo in some cultures, and others see it as tempting fate. Choosing to focus on one of these barriers led me to my evidence-based intervention, which was to make healthcare professionals more comfortable with discussing advanced care planning with patients and their families by encouraging them to complete their own advanced directives, improving their communication skills, and providing them with the tools and resources to facilitate those discussions. When making our own advanced directives, we become more comfortable and better equipped to have these difficult discussions. Using the mnemonic value improves communication skills by offering direction and focus to the discussion. It includes valuing what family members say and eliciting questions. The tools for healthcare professionals included the MOST form, an evidence-based comprehensive document that allows numerous scenarios to be explored, such as use of antibiotics or trial periods of intubation. Lastly, a multidisciplinary team approach was encouraged as a resource where healthcare professionals use one another's unique knowledge and skills to support advanced care planning discussions. The socio-ecological model was recommended as the framework to support this change, with emphasis on the organizational level for influencing the social environment to shape the behaviors that promote successful advanced care planning discussions.